Hey everybody, welcome back to another episode of Twisted Tuesdays. This is the day that I sit down and share with you guys a little bit of information about patients that I see here at the office and the things that we're testing and the things that we are finding out. And we're looking at people's health differently. We have a different perspective here at the Wellness Way, where we can take things from the past, look at them just a little bit differently, and arrive at a different outcome and really to help change people's lives. People that are stuck with their health, they have more questions than answers. That's what I really like to see in a patient, is somebody that's been looking and hasn't been able to find good answers. And so they eventually end up in my office because they want me to look at their health and their blood work and their tests differently, because they've taken these tests to many different providers and none of them have been able to help them. So I feel fortunate enough to be part of people's lives and assist them in looking at things a little bit differently, okay? So this patient that we have today is a very unique one. She or he is quite complex. But again, I had to put two highlighters in my pocket today because I like to use highlighters when I go through blood work. And I had a stack of blood work to go through today. So I doubled down and I armed myself with two highlighters because I was highlighting a lot of stuff. This patient that I'm going to talk about today, she has a total of 5 blood works. Okay, so it's a she. I can't hide it. Her main complaint was systemic or full body pain. Okay, so she has pain in her ankles, knees, hips, in her intestines, in her abdomen, in her shoulders, everywhere. Okay, she also has had her gallbladder removed. Okay, gallbladder removal surgery is the #1 surgery in the United States. Again, to take a look at my cholesterol presentation that I gave on Facebook just the other night, I talk about cholesterol and how that relates to the gallbladder. The gallbladder typically is something that we blame, but it's really not the gallbladder's fault. But if you take a look at my cholesterol video, you'll find out why, okay? So it's really upsetting to see that we're taking out people's gallbladders when that's not even the problem, okay? That's a side effect of something bigger. It's not the condition. So people that get their gallbladders taken out, they don't have a great time afterwards, okay? It's not a solve. It doesn't solve anything. It just exchanges one issue for a different issue. So this patient is having widespread pain throughout her body. She's had her gallbladder removed in the past, and okay, she's also a smoker. Okay, we see a lot of smokers. You know, we know what it does, but yeah, it's very addicting and it's sometimes very hard to overcome. But we need to understand that what we choose to do to our bodies will have consequences, and we'll see that in her blood work. Okay, so again, lots of blood work, lots of tests and everything like that goes into a patient that's as complex as her. To me, she's not complex. It's actually quite exciting. It's like a puzzle, okay? There's some 100-piece puzzles, which is fun. Then there's some 500 puzzles, and those are more entertaining in a way. They're more challenging. But this patient is like a 10,000 puzzle, okay? So taking a look again, what I like to do is I write out all of the blood work like it's a baseball card, okay? So baseball cards on the back, they have statistics, and it's really easy. You just flip it over and it has all the information. So I do the same thing with a patient that has multiple blood works. And then what I'm able to do is just take a look right across the board to see how numbers are going up or going down, and it helps me paint a picture so that I can find out more information and paint a better picture about the patient's health, okay? So when we take a look at this blood work here, we can see since November of 2019 up until today, because I just got her new blood work in today, she's been running a chronic infection, okay? So this blood work shows that she has infections inside of her blood, And at one time she had a urine analysis done, and it also shows infections inside of her urine, okay? So it's inside and out basically. Her white blood cells are reacting quite aggressively towards this infection, but it still can't overcome it, okay? So it's a constant battle. And I have lots of patients that know that their immune systems are just constantly fighting and fighting. And what that does is eventually, just like any war, you start running out of supplies, you start running out of army men, and it's just a slaughter, right? And so inside of our bodies, when we start getting systemic pain, that can be a sign that we've been fighting some sort of inflammation or infection that is just robbing us blind. Basically, it's sucking the life out of us. And if we don't change what we're doing, that will continue to rage on, okay? So it's important that we listen to our bodies and we look for answers, right? So again, taking a look at her blood work, she's showing chronic infections. So she's had an infection for over a year, okay? She's also low on vitamin D. We know vitamin D is a huge part of our immune system response. So that's definitely something I'm gonna need to talk with this patient about, okay? The next one is we ran the Wellness Way Immune Panel. Yes, you are able to run lab tests that show how your immune system is, okay? Unfortunately, a lot of docs don't prescribe this type of immune panel because it's set aside for AIDS victims, okay? It's known in the industry as the AIDS panel. So most of us know what AIDS is. It's basically a disease that knocks our immune system out, okay? So they run these immune panels to see if their immune system is alive. So my question to you is, why are only AIDS patients needing to know where their immune system's at? We all need to know where our immune system is at, especially during this time, during 2020, where there's a lot of fear of the unknown. Well, the good news is you can know whether or not you're susceptible or if you should be afraid of 2020, okay? And that's what we do every day at the Wellness Way, all right? So when I take a look at her new blood panel that I drew for her, again, we're seeing a lot of sugar dysregulation. What that means is she's smoking, causing a ton of inflammation in her body. She's not putting good fuels inside of her body, which is creating a high sugar levels in her blood. We know that as sugar raises in our blood system, our immune system goes down. If our immune system's down, we're going to fight chronic infections 24/7 until we change what we're doing to our bodies, okay? Again, our bodies are champions. They like to win. We're programmed to be amazing people, but unfortunately, a lot of things that people suffer with are self-inflicted. So it's things that we're doing to ourselves, whether we know it or not, it's still gonna affect us, right? So you guys all know that I had a past where I dealt with anxiety and depression, and I followed the major medical route just because that's all I knew, okay? I don't blame myself for taking those medications and doing X, Y, and Z to help combat that those issues that I've been challenged with because I didn't know better. But now that I know the Wellness Way, I do know better. And I like to announce that I've been off of my medications for about 5 or 6 months. Is that right? Mm-hmm. Clear turkey? Yeah, it doesn't matter. What's awesome is, yes, you are able to get off of those medications when you change what you're doing, okay? So for 15 years, I did the same thing over and over and over. I expected a different result, which is the definition of insanity, right? And I felt like I was insane because I tried so hard and I didn't get the results, but I kept doing the same thing. So just like this patient, she's been doing the same thing over and over, and then she's so fed up with how she feels that she came in and saw me and said, please do something different. And I said, okay, I will, okay? The other marker that I drew in this patient's lab is called CEA. It's a cancer marker. What it helps indicate is a rapid growth of cells. Okay, so we know cancer is a tissue that is unable to be controlled by the immune system. Okay, so remember that every single day our immune system does a lot of things, but it kills bacteria. Our immune system kills viruses, fungus, yeast, and cancer. Okay, so every day we're fighting cancer. Cancer it doesn't just show up magically, okay? This is something that shows up when our immune system allows it to show up, okay? So with this patient who has chronic infections, who has uncontrolled sugar levels, who's a smoker, who has her gallbladder removed, again, a gallbladder is just a symptom of something bigger, okay? So getting your gallbladder removed isn't going to erase what's currently happening in your body. All right, so her CEA number is a lot higher than what we would want it to be, okay? So I'm going to have to sit down and say, hey, you're showing consequences of what you've been doing to your body. This is something to take very seriously, so you really got to know, you got to think to yourself, is it worth it? Is what I'm doing to myself currently, is it worth the risk that is now showing up in the blood work, okay? So that's unfortunate, but what's nice is the immune system, because we ran her immune panel, it's responding. So all of her CD4, CD8s, all of her helper cells, killer T cells, B cells, all of those wonderful immune cells that we have, they are up, which is reassuring because she has the power to fight, but if she keeps this battle going, she's going to lose. The cancer is going to take over and she's going to be a statistic, okay? We don't want to be those type of statistics, especially when we have the information that allows us to make a change so we have a different outcome, okay? So that's basically the rundown of this patient today. Again, it all ties in to this word right here, inflammation. So again, our body uses inflammation to show us that there's something wrong, okay? Just like if we are outside in the sun for too long, we get sunburns on our skin. That sunburn is a type of inflammation. It turns really red, right? Blood rushes to the area because we've damaged our skin cells because we took in too much sun, okay? So what are we doing day in, day out that's similar to just being in the sun for too long? Is it smoking? Is it gallbladder issues? Is it sugar levels? Those are all things that lead to this guy, inflammation. Once we have a high level or a chronic level of inflammation in our body, it will lead to autoimmune conditions, hormone imbalances, arthritis, weight loss, cancer, infertility, thyroid disease, and type 2 diabetes, okay? So I'm going to be giving a talk this Thursday about inflammation. We already have quite a few people signed up for it. What's nice about the internet is there's unlimited seating, so you guys are all welcome to join me and learn a little bit more about inflammation and how that can directly impact you and your family's life. So again, thank you for joining me for this Twisted Tuesday. I hope I can always bring you guys something unique and interesting. Think about how you guys are doing with your health and your bodies. Are you living in fear and uncertainty, or would you rather live in confidence and be proud of yourself for knowing exactly what's going on in your body and dealing with it properly, okay? So enjoy your meal tonight, enjoy your family, love on them as much as you can. You never know when you're gonna get another chance to say hi. If I sound nasally in this video, it's just because I've been crying a lot today. The reason why I was crying is because I had to put my dog down, okay? So again, it's just like losing a family member. He was an amazing German Shepherd, and I love him with all my heart, and I can't wait to see him again in the afterlife. So again, enjoy your families because you never know. And I love you all. Thank you for joining me, and have a great night.